Hello, guys. My name is Brian, and my presentation is about who benefits ultimately from the universal health insurance system and global vaccine distribution. To start off, I want to introduce myself. I'm a rising senior at Seoul International School in Seoul, South Korea. I volunteered at a public clinic for 5 years. It was for underinsured immigrant workers in Korea. This community service experience resulted in my passion for understanding the intricacies of global health. In college, I hope to continue to learn ways to work through these intricacies. So before I say why and how my topic is a global health issue, let's define global health. Global health is an area of study and a set of practices that prioritize the health of people and the equity in healthcare in a worldwide context. And I believe global health should be a universal endeavor that is not only pursued by some developed countries, but is necessarily pursued by all countries. In this sense, my presentation talks about some of these global health pursuits. One is on the universal health insurance system, and the other is on global vaccine distribution. In terms of these two pursuits, I compare and contrast the methods and outcomes of South Korea and the United States in the pre and the post pandemic world. Although I mainly focus on two countries, these policies are based on the foundation that commodities that affect global health, like air, water, spaces, and communities, are all spanned across and shared between different nations. So, what this means is that the entire world needs to be fully aware of situations that threaten global health. And once all of the countries are fully aware of global situations, they should be in a certain level of agreement with the solutions in order to truly ensure national and global health. So, for instance, the universal health insurance system in South Korea played a big role in South Korea successfully coping with the pandemic. The system sets a very affordable price for visiting a doctor and receiving quality healthcare. This is possible because the national health insurance system covers most of its costs. Affordable prices lead to more frequent visits in hospitals, which enables doctors to confer with a larger number of patients per day and increases the turnover rate of hospitals. On the other hand, the health insurance system in America is much more complex. The biggest difference is decentralization. Most Americans have to individually enroll in a medical insurance scheme of a private insurance company such as Kaiser Foundation, CVS, Cigna Health, and pay those companies regularly to receive coverage. Since the coverage for medical treatment is dependent on clients' ability to pay, rich clients pay more money to receive better coverage than what is often affordable by most people. This creates a blatant inequality between the types of medical treatments that each patient receives. And the unregulated system lets private hospitals charge a large amount of money to their patients. The price a patient in the US needs to pay for a single visit to a doctor is 150 US dollars on average, while it is only 2.5 US dollars on South Korea. Such high fees for a single clinic visit in the US create reluctance to visit hospitals, which results in not going to a doctor until conditions becomes very severe. The American system has built a high threshold for hospital visits and insurance enrollment, making 42% of the US working population without health insurance. This leads to a less active screening of the virus and consequential difficulty in tracking its spread. Learning how the health insurance system affects population health and understanding why universal health care is a better strategy are all so important because when it comes to health insurance problems that are global, biomedical technology cannot solve it alone. In fact, biomedical technology comes later than the healthcare systems. For example, America is known to be the most advanced in the field of biomedical engineering and life sciences. But they are also known to have had one of the poorest countermeasures to the COVID pandemic, largely due to their unorganized and privatized health insurance systems, which limited their countermeasures to the pandemic in terms of speed and scalability. In fact, when Dr. Sharfstein, the vice dean of the Johns Hopkins Bloomberg School of Public Health, spoke in this program 2 weeks ago, I asked why the American health insurance system is the way it is. Like, why is it structured like that, and how is it beneficial global health wise? His answer was that the American health insurance system is not really a system, but rather a chaotic blend. This discussion on universal healthcare relates directly to why we need to globally distribute vaccines. Global distribution of vaccines is important not only because it can save numerous lives, but also because it will benefit the world and the country's own economy. If a country that has developed vaccines only distribute the vaccines within their own nation, the trade and the global economy will continue to cripple, further affecting the nation. In the globalized world, it is both socially and economically advantageous for vaccines and healthcare to be distributed globally, rather than just to a few countries. Really, the only benefit of monopolizing the patent of the vaccine is the political leverage, which is a whole nother discussion that I will not discuss in this presentation. My point is just that although we want to believe that the pandemic is over with the introduction of the vaccines in America, the discussion on the universal healthcare system is still significant because history repeats itself. There will be another pandemic or global health catastrophe in the future, just like how the Middle East respiratory syndrome, MERS, and COVID-19 struck the world after the severe acute respiratory syndrome SARS. Even right now, the mutant coronavirus in UK has brought about a situation where despite 80% of the population being vaccinated, the number of confirmed cases has been soaring. Likewise, a pandemic or a global health catastrophe may come earlier than we hope. To relieve and minimize the damage in lives and the economy, there are two ways. One, prevention and containment, and two, vaccine development and distribution. But if there's a new mutant, the current vaccines won't be as useful. This means in order to prevent another irreversible damage, there should be a fundamental and foundational change in the healthcare systems and the public health strategies of the US. For instance, I have mentioned Korea's universal health insurance system as an example of good prevention and containment. According to Dr. Manabe, a professor at Bloomberg School of Public Health, who spoke in this program last week, the first and foremost important rule of global health is win-win or walk away, meaning that in order to make people take action, the change in action needs to be beneficial enough to make those busy people make the dedication. The U.S. opening the U.S. opening up the patent of the vaccine may not seem beneficial to the U.S. in the short run, but it will relieve the COVID-19 crisis a lot faster and on a much more impactful scale. The faster the global crisis gets resolved, the more it will benefit ones who release the patent by allowing active economical and societal exchange. Eventually, the economic, social, and environmental benefits that the US will get will outweigh the current benefits of keeping the patent, creating a win-win situation. That is probably why President Joe Biden finally announced that the US will be freely distributing 500 million doses of vaccines to 100 different countries. This seemingly philanthropic action is definitely a win-win situation for both America and the rest of the world. So, who benefits ultimately from the universal health insurance system and global vaccine distribution? Is it the countries that receive the vaccines for free, or is it the US itself? Although it may seem like a loss to the rich people to pay more money for the healthcare of the less rich population, and it may seem like a loss that the US government is distributing 500 million doses of vaccines, the reality behind that is that it eventually creates a win-win situation for everyone and is true to the ideals of global health. And that brings to my references. And thank you all for listening to the presentation. I appreciate everyone in GHLC and the executives. And if you have any other questions, please contact me via email through 110brian.lee@gmail.com. Thank you so much for listening.